One patient in particular, she came in with significant foot drop as well as very severe back pain. And in looking at her standard evaluations, which are X-ray, as well as she did have an MRI on her back, and it was pretty much from a conventional perspective, a foregone conclusion this woman's going to have surgery. She had significant abnormalities, including disc and spinal problems in the low back, and she was tripping. And it was all associated, we thought, to the low back problem. Well, we started with the Neuro 20 evaluation, put her in a suit, and by the third treatment, she noticed significant improvement in the foot drop. And by the time she was 6 to 8 treatments out, she was not only completely well from the foot drop, she had no back pain. Typically with a person, when they come to me with that kind of a back issue that do not want to have surgery, we look at prolotherapy. Prolotherapy is an injection process. I particularly am using nutrition to go in there, so I'm using vitamin C and B complex and glucose and ropivacaine. We inject to tighten up the ligaments, to stabilize that back. And she had even scheduled to have a prolotherapy session with me. By the time we finally sat down to do that, we were a couple months into the Neuro 20 treatment protocol, and she was pain-free. So I told her, we're not going to do prolo. We don't need to do prolo because you have no pain. You're stable. You're able to do everything that you want to do, including hiking. We're going to wait and see what happens. And so it's very impressive to me, one, because we helped her foot drop, but number two, even with the anatomical abnormalities in the back, she has no pain. And the only reason that you do any kind of invasive therapy anyway is if people have symptoms that are interfering with their quality of life, either pain or some kind of disability. So that one really one of the more impressive ones to me, and it was early on. Another one, we have a lady who had a brain tumor, and that was removed. Unfortunately, there's several in the family, and this was over 20 years ago, and she was left very much like a stroke patient with complete left-sided weakness, contracture of both the upper extremity and the lower extremity, very significant difficulty in ambulation, and of course all of the things that go with that then, the depression, the anxiety, the difficulty with getting around and doing her daily activities. So we had been working with her I had been working with her for probably 5 years, and we had been addressing hormone situation, we've been addressing nutrition and diet, and we made some improvement. She'd been through gamuts of physical therapy, occupational therapy, speech therapy, a number of therapies correlated to everything around the mechanical side of her disability. We started her on Neuro 20, and within 2 treatments, she was able to take this contracted left hand and open it enough so she could actually pick up a jar and carry that jar across the room. Something that she had not been able to do for over 20 years. So we weren't talking about, oh, gee, it's been a few months. We're talking 20 years this woman was not able to function with this left hand, and now she was able to. We've continued to work with her, and she has continued to improve. Like most very significant neurological injuries, there's always a stair-step of improvement in order for the body to catch up with the brain. And what we see is that she plateaued a couple times on her physical improvement, but her WAVI said the brain is continuing to improve. And sure enough, then the body begins to pick up after that. As well, she's been on the nutrition, so that's a very important thing as well. In order for the brain to improve, the nervous system to regenerate, you have to have the building blocks present. And we make sure that all of our patients have that.